Xolegel gel is used to treat seborrheic dermatitis, a type of dandruff caused by a fungus infecting the skin or scalp. It helps to relieve dry, flaky skin on the scalp, face, ears, chest, or upper back. The active ingredient, Ketoconazole, works by stopping the growth of the fungus. It is recommended to apply a thin layer of the gel to the affected area once daily, usually in the evening before bedtime. Be sure to follow the instructions from your doctor for the best results. Before applying Xolegel gel, make sure to read the patient information leaflet from your pharmacist. Use this medication only on the scalp and skin, and be sure to clean and thoroughly dry the area before application. It's important to wash your hands before and after applying the gel. Your doctor will typically direct you to apply it to the affected skin and a small amount of normal skin next to the affected area once a day. The length of treatment usually lasts for 2 weeks, but may vary depending on your response. Avoid getting the medication in your eyes, nose, or mouth, and if it occurs, flush with plenty of water and contact your doctor if irritation occurs. Use Xolegel gel regularly at the same time each day to get the most benefit from it. Wait at least 3 hours before washing the treated area, and at least 20 minutes before applying makeup or sunscreen. Be sure to inform your doctor if your condition lasts or worsens after 2 weeks of use. If you experience burning, redness, or dryness of the treated skin, make sure to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. However, if you notice any blisters or open sores on the treated skin, or if you experience eye swelling, be sure to contact your doctor right away. While a severe allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. As with any medication, there may be other side effects not listed here, so it's important to contact your doctor or pharmacist if you experience anything unusual. If you're located in the US, you can report any side effects to the FDA, and if you're in Canada, you can report them to Health Canada. Before using Xolegel gel, it's important to let your doctor or pharmacist know if you have any allergies to Ketoconazole or other antifungals. This medication may contain inactive ingredients that could cause allergic reactions, so it's best to discuss any concerns with your pharmacist. If you have any medical history, make sure to talk to your doctor or pharmacist before using this medication. If you are pregnant, Xolegel gel should only be used if it is clearly needed. It's important to discuss the risks and benefits with your doctor. If you are breastfeeding, it is currently unknown if this drug passes into breast milk. It's best to consult with your doctor before using Xolegel gel while breastfeeding. When using Xolegel gel, it's important to be aware of potential drug interactions that could affect how the medication works or increase your risk for serious side effects. It's recommended to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's important to consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone accidentally swallows Xolegel gel, it can be harmful. If they experience serious symptoms such as passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, and in Canada, they can call a provincial poison control center. Remember, it's important not to share this medication with others. This medication is specifically prescribed for your current skin condition. Do not use it for any other skin condition unless your doctor tells you to do so. If you need a different medication for another skin condition, your doctor will provide you with the appropriate prescription. If you forget to use Xolegel gel at the scheduled time, use it as soon as you remember. If it's close to the time of your next dose, just skip the missed dose and continue with your regular dosing schedule. Do not use a double dose to make up for the missed one. Remember to apply the gel at the same time each day for the best results. When using Xolegel gel, it is important to store it at room temperature and keep it away from open flames as it is flammable. Be sure to store it in a safe place away from children and pets. When you no longer need this medication or it expires, it should be properly discarded according to the instructions from your pharmacist or local waste disposal company. Avoid flushing it down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.